If you're struggling to quit smoking, nicotine gum could be a helpful tool for you. It works by providing a small amount of nicotine to help reduce the withdrawal symptoms you may experience when you quit smoking. These symptoms can include cravings, nervousness, irritability, headaches, weight gain, and difficulty concentrating. Nicotine replacement products like nicotine gum are most effective when used as part of a comprehensive stop-smoking program that includes behavior change, counseling, and support. It's important to understand that smoking can lead to serious health conditions like lung disease, cancer, and heart disease. Quitting smoking is one of the best things you can do for your health. When using nicotine gum, it's important to follow the recommended daily dosage and to use it at the optimal times to help you successfully quit smoking. When using nicotine gum, it's important to follow the directions on the product package or the patient information leaflet provided by your pharmacist. Do not eat or drink anything for 15 minutes before or during the use of the gum. Start using the gum on your quit day and chew it slowly when you feel the urge to smoke. Most people use about 9 to 12 pieces of gum per day during the first month of treatment, but do not chew more than 24 pieces a day. After 6 weeks, start to lower your dose as directed by your doctor until you no longer need nicotine replacement. If you experience withdrawal symptoms when stopping the medication, talk to your doctor. If you are unsuccessful in quitting the first time, you may need to stop using the gum and try again later. Some common side effects of nicotine gum include problems with the mouth, teeth, jaw, headache, heartburn, sweating, or diarrhea. If any of these side effects persist or worsen, stop using the medication and consult your doctor or pharmacist. When you stop smoking, you may experience common nicotine withdrawal symptoms such as dizziness, anxiety, depression, or trouble sleeping. Chewing the gum too fast can cause lightheadedness, dizziness, hiccups, nausea, vomiting, or trouble sleeping. If these effects occur, chew the gum more slowly. If your doctor has prescribed this medication, they have determined that the benefits outweigh the risks of side effects. Serious side effects are more likely if you continue to smoke while using this product. Stop using the medication and contact your doctor immediately if you experience serious side effects such as severe dizziness, changes in mental/mood, numbness/tingling in hands/feet, or swelling of hands/ankles/feet. Seek medical help right away if you experience very serious side effects such as chest pain, confusion, severe headache, fast/irregular/pounding heartbeat, trouble speaking, or weakness on one side of the body. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling of the face/tongue/throat, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you experience any other effects, contact your doctor or pharmacist. Before using nicotine gum, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as any medical conditions you have such as heart disease, high blood pressure, diabetes, or thyroid issues. It's also important to discuss using nicotine gum with your doctor if you are pregnant or breastfeeding, as nicotine can harm an unborn baby and pass into breast milk. It's also important to inform your doctor about all medications and herbal products you are using before having surgery. Remember, nicotine gum is a form of medication and should be used only as directed by your healthcare provider. When using nicotine gum, it's important to be aware of potential drug interactions. Certain medications may be affected by the change in your body when you stop smoking. It's important to keep a list of all the products you use and share it with your healthcare providers. This includes prescription and non-prescription drugs, as well as herbal products. Be sure to inform your doctors and pharmacists that you are quitting smoking, as it may impact the way your body processes certain medications. Always consult with your doctor before making any changes to your medication regimen. If swallowed, nicotine gum can be harmful, especially if taken in large amounts. In case of an overdose where serious symptoms like passing out or difficulty in breathing occur, it is important to seek immediate medical help. You can call 911 or your local poison control center for assistance. Symptoms of overdose may include confusion, drooling, seizure, slow/shallow breathing, and hearing problems. This medication is not to be shared with others. It is for your use only. If you are using nicotine gum regularly and you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, then just skip the missed one and take your next dose at the usual time. Do not take a double dose to make up for the missed one. When it comes to storing nicotine gum, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and be sure to wrap any used pieces of gum in paper before throwing them away in the trash, away from children and pets. It's crucial to keep all medications out of reach of children and pets. If you need to get rid of expired or unused nicotine gum, don't flush it down the toilet or pour it down the drain unless specifically told to do so. Instead, consult your pharmacist or local waste disposal company for the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.